friends, I'm Dr. Molly Brinkman. I'm a small animal veterinarian near Nashville, Tennessee, and this is a show for people who love their pets, like to laugh, and realize that life is hard, but dogs and cats help. I love veterinary medicine. I'm probably already obsessed with your pet, and this is a show for people who want to learn more about both of those things. Welcome to the Dr. Molly Says podcast. Hello, everybody. Thank you all for listening or watching the episode we did last week with Dr. Crocker. If you missed it, it's a good one. It's an interesting one, I think, for pet owners and maybe people in vet med too. We talked about the cost of veterinary care, specifically emergency and specialty care, and how that differs a lot from GP to a certain degree. And I thought it was a very good conversation. Dr. Crocker is one of my very, very good friends, and we both share a lot of the same opinions about a lot of it, not necessarily everything. We definitely talked about pet insurance some. We posted a little clip from that. I just wanted to expand on the pet insurance part of it a little bit more, because definitely had some people comment about how pet insurance is not necessarily the answer for the cost of care, which for everyone, which is of course true. So not everybody can afford the cost of monthly pet insurance premiums. There's a wide range of those. Some people express concern about the fact that our pet insurance process, most companies are a reimbursement system. So you go to the vet, you pay the vet, your pet insurance company reimburses you, and that is how it is. And at least for right now, I do think that that's best, which we said in the episode. You know, when in human medicine, at least, when your doctor or your hospital is dealing directly with insurance, it has sort of devolved into this situation where insurance companies tend to or start to dictate what treatments or, medications, whatever the patient is getting. That's not going well for human medicine. If you're not following any of my human medicine friends, some people like Dr. Betsy Grunch, Lady Spine Doc, they talk a lot about how insurance companies are decreasing their patients' access to care because of the way that they have to convince insurance companies to let them do the doctors what they think they should do. So anyway, my weariness about moving away from a reimbursement system is that we will head into that territory, and that's not going well for human medicine, and I don't think that that's what veterinary medicine wants. And not everybody can get pet insurance, that's correct, and not everybody can float the money that's required to pay for some type of huge emergency, like a hit by car in the ER. That's an unfortunate reality, and, I want to fix that. I want everybody to have access to the care they need for their pets. Unfortunately, sometimes it's hard to think about, but some of the extensive care that we are now able to do in the emergency room, like saving a bulldog that's been hit by a car and is in respiratory distress, sometimes the cost to actually do that is out of someone's capability. And until another entity is helping veterinary practices pay their bills and pay their employees without their clients paying them, it's just going to be part of the reality of vet med. And now, as far as general basic preventative care, I think there's a lot of ways for pet owners to get access to that at an affordable price. Low-cost clinics. Not every area has them, but a lot of them do. So anyway, this is a very big conversation. We tackled a little bit of it last week. I definitely want to talk about it more here. So stay tuned. We will talk about it more, but just thank you for your watching and your feedback and your comments and your thoughts, because they're all very important. Pet owners and people in vet med alike. Okay, I moved my chair today. Harrison may hate this, so he may say that was a terrible place to sit, but I feel like the light is better, so we'll see how this goes. We're going to do another dog breed episode today. We're going to do cat breeds, I promise, but we're going to do one of my favorite dog breeds today, and that is the boxer. So if you have a boxer, know a boxer. To know a boxer is to love a boxer. I mean, truly. This is an adorable and hilarious dog breed. I want to shout out, this episode is dedicated to my boxer nephews. So my cousin Abby, who's like my sister, she has 2 boxers now. And then her heart dog, Percy, was boxer who we lost a few years ago. But so she's had these 3 boxers, and they're just the funniest dogs. So she has Caney and Warner right now, and had Percy. And I feel like I know boxers well because of her dogs. And they're very funny, and I love them as patients too. So we're going to just dive right in and talk about the boxer. So if you're thinking about getting a boxer, this will be some great info for you. If you already have a boxer, you may learn some things. And okay, here we go. So boxers, like I said, to know a boxer is to love a boxer. Where did they come from? If you've never seen a boxer, they're generally large breed dogs. They can come in different colors. We see fawn boxers. You can see brindle boxers. There are black and white boxers. There are white boxers, tricolor boxers. They come in a variety of colors. And they originated from Germany in the late 19th century. They kind of descended from a breed called the Bullenbeißer. So it's kind of a mix of that and the English Bulldog. So the boxer was originally bred for a couple different purposes: hunting, bull baiting, interestingly enough, and just kind of versatile working dogs. Interesting fact about the boxer, they became messengers and guards in World War I and II. And now, in the modern world, most boxers are in homes as family companions. They can be used for therapy dogs, and they are funny, clownish, forever toddler dogs. If you get a boxer, I would not bank on that dog becoming just super chill early on, similar to a lab, but they're even kind of spazzier than a lot of labs, but in like a very charming and adorable way. They have really big personalities. They, like I said, are funny. I don't see a lot of aggressive boxers personally as a veterinarian, even in the office. They're usually great to work with and can make really great family dogs. So they are known for being loyal. Some people think that they're intelligent. I'm not sure about that. Have I met an intelligent boxer? Yes. So Abby's dog Percy was very intelligent. Her dog Caney, I don't know how smart Caney is, but he sure is charming. They can be a little bit protective with their people, but they're very expressive. I would say they're emotional dogs, like in a very adorable kind of way, and they just are sort of goofy. So I love a boxer, if you couldn't tell. So those are some of the great things about boxers. A lot of them think that they're your lap dog. So they could be 85-pound lap dogs. They just want to crawl into your world. These are considered brachycephalic dogs. So when you see there's kind of a myriad of boxers, some of them have more smushed faces, snouts than others. So if you are looking into getting a boxer, I definitely would encourage you to look for less brachycephalic boxers. So they're going to have longer nose, less smush. That leads to a lot less problems, but they can have BOAS, and they are considered brachycephalic dogs. So if you've listened to other episodes, we've talked about these conditions. Brachycephalic dogs just have more issues, more predisposed to respiratory issues and issues in their throat and airway. And so boxers are less severe than dogs we think of like English Bulldogs and Frenchies, but they definitely are under this category. So a lot of these dogs will have some heat sensitivity. They can be very loud, have a lot of snoring, loud noise when they breathe, and they can have exercise intolerance because of it. But again, if you're looking for a boxer, I really encourage that you find breeders who are breeding for less smushed faces. That is ideal. Their risk with anesthesia can be higher because of that brachycephalic classification. So those are important things about their airway to know. You should know if you're getting a boxer, you are signing up for a brachycephalic dog and you want to look for less smushy ones. So boxers definitely have some breed dispositions for medical issues. So the most kind of unique and rare one we're going to talk about first, and it's heart disease. So there is a gene mutation that boxers can carry, and it's STRN is the gene, and it can cause ARVC, which is, we call it boxer cardiomyopathy. So the term for it is arrhythmogenic right ventricular cardiomyopathy. So this is abnormal electrical conduction and changes in the actual muscle and tissue of the right ventricle. So this is just a genetic problem that leads often to heart failure in these dogs if they carry the gene. So we don't have time to talk about genetics. One day we should do that. But so when we talk about genes and hereditary problems, so this is something, because it is inherited, it matters what the parents' genes are. So if both parents in a breeder situation for boxers carry this gene mutation, then they can pass that on to their offspring. They're much more likely if they both carry this gene. And then if one of them does, that still can happen. And this mutation and this issue, even if a dog only has one copy of the gene, they can still develop this. And even dogs that don't have that boxers can just develop this condition because they are boxers. But their likelihood of that is a lot higher if they carry the gene. So the mutation of the gene. So what happens with this disease, they'll just start to have signs of heart disease. Often they'll have syncope. So syncope means in dogs, basically they pass out because of a heart issue. They can have syncope, or it's kind of like fainting during exercise or excitement. And what sadly happens sometimes in these dogs is that they just have sudden cardiac death, and they seem fine until one day they're not. And so it's a terrible disease. Thankfully, responsible and ethical breeders are testing for this. And so it's being hopefully bred out of the breed, but it's a big concern in these dogs. So there is NC State has a very affordable test for this. There's really zero excuse for a boxer breeder to not be testing their dogs for this gene mutation. If they're not, it's either because they are unethical and cheap and not spending the money on it, or they don't know, which means they have no business breeding boxers. So if you are looking for a boxer and they're not testing for this gene, then you need to not buy a dog from that breeder. There's other testing or screening that can be done in a dog that's already come to the earth. So Holter monitoring to watch their EKG for 24 hours can be done. And then an echo and ultrasound on the heart can be done. So the average kind of age of boxers that will develop this, I think, is around like 5 to 6 years old. So it takes time for it to develop into this more advanced disease. So it's not going to be obvious right away when they're young. They're not going to like have a murmur when they're a puppy that tips us off to this. So yeah, you want to check that if you're going to buy a boxer from a breeder. So something to look for, something to know about, ARVC, boxer cardiomyopathy. I'm trying to think if I've personally ever diagnosed a boxer patient with it, and I don't think I have. I'm sure some of my vet friends out there have, and I know my cardiologist friends have. Another sort of medical predisposition boxers can have is a type of cancer called mast cell tumor. One day we'll talk all about mast cell tumor. It's a very interesting disease type of cancer. So mast cell tumors are more common in boxers than a lot of other breeds. So this is a really important reason why if you have a boxer, you should absolutely be having them examined at least once a year, and you should be feeling them for any new lumps or bumps, and always have your vet check that out. Your veterinarian, especially if you have a boxer, or really any dog, but especially a boxer, should always be offering what we call a fine needle aspirate of any new lumps, growths. This is where we put a needle just directly into a mass that we find. And we usually are able to collect cells out of that growth with that needle. We then spray them on a slide. We stain that and look at it under the microscope. Mast cell tumors, we'll talk about them, like I said, in depth at some point. They are one of the few types of cancer in vet med where in general practice, most veterinarians are going to be able to look at a slide and say, yep, that's mast cell tumor. And so that's something we want to be looking for in boxers. Interesting thing about boxers is when we talk about mast cell tumors, there's different grades of those tumors, and higher grade is more serious, more likely to spread to other places and be harder to treat. Boxers, even though they're more likely to have mast cell tumor, they're also more likely to have low-grade mast cell tumors. And when we talk about low-grade mast cell tumors, those are more likely to be able to be treated just locally. So basically, we remove them surgically or with a treatment called Stelfonta. We remove them, and then that's usually curative in the lower grade mast cell tumor. So that's the good news. If you have a boxer, they are predisposed to mast cell tumors, but if they get them, they're more likely to be low grade. And so the take home from that is check for lumps and bumps, always have your vet check them out, and always make sure that your vet is offering a fine needle aspirate to check and see what that little lump or bump is. Another cancer kind of PSA is that the incidence of some other cancers in boxers is slightly higher than the average population of dogs. If you talk to any veterinarian or veterinary technician, someone who works in vet med, and ask them, what kind of cancer do boxers get? A lot of them are, other than mast cell, are going to say brain tumors. So boxers do have a little bit higher incidence of brain lesions, brain tumors as they age. So anytime someone in vet med sees a boxer that's, 8 or older and starting to have any type of neurologic or behavior change or something like that, they probably have a little voice in their head saying, oh, what if this dog has a brain tumor? So lymphoma is another cancer that's that way, slightly higher incidence than the average dog population. And then hemangiosarcoma, the type of cancer we've talked about before that often affects the spleen, the liver, and or the heart base, is slightly higher in boxers than the average population of dogs, but less common than with like our golden Labrador retrievers. Okay, not to keep talking about problems that boxers may have, but I want you to be informed. Another common issue in these dogs is allergies and skin disease. We think that, this is probably due to some overactivity in some of their immune response, just generally as a breed. And so they can have hypersensitivity to environmental allergens as well as food. So if you have boxers that have recurrent ear infections, skin issues, they're itchy, skin infections that start as just redness and then they get these lesions, they get some superficial pyoderma on their skin, and this is a recurrent problem. A lot of these dogs do have underlying allergies. Like we've talked about before, more dogs have environmental allergies than food allergies, but food allergies are very, very possible. And so this is something that most of the time, if you're getting a boxer, you're signing up for possible allergy management. The good news is we do have a lot of ways to manage allergies these days, but that isn't cheap, especially in a large breed dog. So it's definitely something that's more common in boxers than the average dog. And something I always, tell people that have boxers or breeds like this with allergies, one supplement I think that's great for boxers and other dogs with skin itchiness issues is to get them on omega-3 supplementation. So a really nice fish oil. One brand I love is Nordic Naturals. This is not a sponsored comment, but Nordic Naturals makes a great fish oil, sustainably sourced, high quality fish oil. But omega-3s are just really good for dogs like boxers. So if you have one, if they're not on omega-3 supplementation, I would definitely chat with your vet about that to see if it's a good idea. A lot of boxers end up on like novel protein or hydrolyzed diets, but that's usually because they do have these allergies. And then just something while we're talking about food is one day we'll talk about the grain-free debacle in dog food, but because boxers do have predisposition to some heart issues, I would absolutely never feed a boxer a grain-free diet. There's really no scientific evidence that feeding a grain-free food is of any benefit really to 99.9% of dogs. And so I just wouldn't take any risk feeding that, especially to a boxer. Okay, couple more things. I really do love boxers, but they do have these issues. They can be more predisposed to cranial cruciate ligament tears, which we've definitely talked about here. This brings up the idea that it's really important to keep these dogs in shape. I do see a lot of overweight boxers. We want them to be nice and lean. We want their body condition score to be 5 out of 9. And then regular exercise, walking, running, playing, swimming, things that are going to keep their muscle mass up to support muscle mass cell. What did I say? Muscle mass up. To support them. We want them nice and lean and muscly. This helps support their knees, support their cruciate ligaments. We want to keep them not having TPLO surgery if we can. Boxers can also carry a gene mutation that makes them more predisposed to degenerative myelopathy. And if you've never heard of degenerative myelopathy, it's a progressive neurologic condition that is degenerative. We can't treat it. We can't stop it. But there is genetic testing to see if boxers carry the gene that makes them predisposed to it. So again, this is something that you should be looking for if you're looking at breeders for boxers. If they're not doing this, please do not buy a dog from them. If they don't know what it is, please run far, far, far away. We don't want breeders to breed any carriers, especially two carriers together. And degenerative myelopathy one day is another thing we should talk about for a whole episode, but it's a terrible disease. It's hard to watch, hard to be a pet owner for it. And I would love for us to never have to see dogs with degenerative myelopathy again. So just another thing to look for if you're shopping for a boxer breeder, degenerative myelopathy testing. It's the SOD1A gene mutation that makes these dogs specifically more predisposed. Other than that, a lot of boxers can, because they're just generally large breed dogs, they can develop orthopedic issues, arthritis as they age. So in addition to fish oil, I think some really good joint support is important for these dogs. They have really big personalities. They're very social. They do really well in homes with other dogs usually. They're dogs who like to go out and see other dogs. So that's very good for them. I think socialization for boxers is really, really important at a young age. I do know some boxers that are a little bit anxious, and I think that they do really well if they can get some mental stimulation. They really want to be your friend. They really want to have a human companion too. And so, if you're getting a boxer, I would expect them to sort of be attached to you to a certain degree. Daily exercise is really important for these dogs. I know, at least from my nephew boxers, they're very happy to be couch potatoes when they're in their house with their people, but they love to explore. They love to exercise. They love to get out. They definitely can get themselves in trouble. I definitely know a lot of boxers who have eaten things they shouldn't, needed foreign body surgery. My nephew boxer Warner, he finds all kinds of things to eat. Ask my cousin Abby. He's eaten electrical wires many times out in the yard. He finds the wiring to the lights and the landscaping. Her boxers are always eating her pulling her plants out of the pot in her house and getting potting soil everywhere, eating that. Anything else they can find. I think these dogs probably thrive on structure and a mix of structure, good exercise, and just being your friend. Like I said, companionship. So that's what I have for you about boxers. I think if you are thinking about getting a boxer, I think it's important to know that they do have some medical issues they're predisposed to. So I think getting pet insurance, like I said, for your boxer at a young age, right when you get the puppy, is a really, really good idea. I think, you'll be glad for that later on in life. And I think you need to be at the vet on a very, very regular basis with a boxer. We want to be looking for any changes in heart health, skin issues, signs of allergies. I think they can be a good bit of work. I think training when they're young can involve more than the average dog, just because they are so high energy, so curious and playful. And they're big dogs. Large breed dogs come with more expense in general. So that's true of boxers as well. But they really are lovely dogs. And I find them to be very attractive dogs. I think they're just so cute. And I love when they have a little bit longer nose, less brachycephalic. But you do have to be very careful when you're buying a boxer. You want a high quality breeding operation that's doing all the testing and looking for those gene mutations that can cause really devastating disease. So I would love to know if you have questions about boxers or your stories about your funny and cute boxers that you have at your house. So let me know. I hope this has been helpful. And you can follow me, Dr. Molly, at Dr. Molly Says, and the podcast page, Dr. Molly Says Pod, to catch clips of every episode. Make sure you're subscribed on YouTube or other podcast platforms so that you can see every episode drop, and leave a review if you would like. And we will see you next week on the Dr. Molly Says podcast.